Moving on. People Before Profit Solidarity, Deputy Gino.
And I too want to show our solidarity to the poor people that died crossing the English Channel. Pretty absolutely awful situation in regards to that situation. Tánaiste, this pandemic has showed us many things about this country. The good things and the not so good things. It has shown who we are and where we want to go. It has brought the best out of our people. Collectively, we have responded to the call of social solidarity to watch out for one another. It has brought many of us together that were never together before. The ongoing public health emergency continues to bring anxiety, grief and fear. I would argue that this pandemic continues to question what is very important in society. And one of them issues is our health service. Never before have we needed it to protect us and care for us. At last year's general election, it was a political earthquake. It was a message to the political establishment that people have had enough. And that enough was the state of our public health service, namely a two-tier health system. Tánaiste, almost 1 million patients will be on a waiting list by year end, with almost 300,000 waiting over the year for treatment. There are only 3 hospital beds per 100,000 population when the OECD average is 5. 1 in 5 consultants' posts are vacant, and our ICU capacity per capita is little more than average for the OECD countries. And we have some of the most dedicated, best educated staff in our health system. And Tánaiste, it is shown that our two-tier health system is deeply flawed and deeply unequal. And these are from historical legacies of cuts to beds and health resources. And we can argue all day in regards to who done what and to who done what. And that is a policy that has been advocated in relation to your government and previous governments in relation to private healthcare and the provision of competing against public healthcare. So my question, Tánaiste, to you is, do you have the stomach to reverse them cuts past and present? Can you grasp the challenge that the electorate of this country said to Fine Gael or Fianna Fáil that this is not good enough anymore? Public services, such as our health system, is paramount. We want a universal health system that looks after people if they're a millionaire or on social welfare. Because if you don't, there will be a price to pay.
Thanks, Deputy. First of all, at the outset, I want to acknowledge the simple fact that our public health service is too small for a population of our size of 5 million people, and an ageing population too. And that is not the only reason, but it is one of the reasons why too many people have to wait too long for the healthcare that they need. And I acknowledge that, and I acknowledge it absolutely. You've asked me, do I have the stomach to reverse the cuts to our health service? I've more than the stomach for it, Deputy. That's exactly what I've been doing during my time in government. From the moment it became possible, around 2014 or 2015, when the country exited the IMF bailout programme, we've been expanding our health service and investing in it. And again, I'd refer to you, don't take my word for it. Check out this publication, Health in Ireland, Key Trends 2021, just published the other day, which tells you exactly what has been happening in our health service over the past couple of years. In 2015, I took the decision to reverse the policy of reducing the number of beds in our health service. And since then, every year since 2015, we've seen an increase in the number of hospital beds in Ireland. When most countries are actually reducing the number of beds, we've been increasing the number of beds, and that's why we're getting closer every year to that OECD average that you mentioned. 900 more beds today than we had before the pandemic began, roughly 2,000 more beds than we had back in 2015. Again, from this document, 44% more doctors in our public health service than was the case 10 years ago. How many people know that? But it's a fact. 44,000 more doctors working in our public health service than 10 years ago. A health budget of 22 billion euros now a year, the highest ever. and increasingly a high one on a per capita basis. Expansions in making healthcare more affordable. For the last couple of years, we've been reducing prescription charges for those with medical cards and also for those who don't. We've brought in free GP care, for example, for children under 6 on a universal basis. We're bringing in free contraception later in the year. So this is very much a programme that's being pursued and being pursued in reality by this government. 1,700 more nurses than we had at the beginning of the pandemic. And yes, we have a struggle recruiting and retaining staff, as does almost every health service in the world. But it's not a surprise that we should have that when we're expanding so fast. So many more posts being created, so many more beds being added to the system, new hospitals being built all the time. And we're making a lot of progress in that regard. But we've a lot more to do, and I acknowledge that.
Deputy Kenny.
Taoiseach, I acknowledge that. And they're good things in society, where there's more capacity, more beds, more staff. But it still doesn't answer the question in relation to why do people in this country still have private health insurance? More than 50% of people have private health insurance. Now, why is that? You know, because, you know, in general, people want good health care, whether it's private or public. But generally, the kind of sentiment and the patterns across the world is a public, a one-tier health service, a universal health service, such as what's happening in Britain, the NHS. And the outcomes for everybody are really good when there is a health system that's are kind of from cradle to grave. And there's a creeping privatisation, Minister, that has always existed in our health system, and people are doing very well out of it, are profiteering from it. But the question is, do you have the stomach to end that system, where there is no two-tier health system or a universal health system? Thank you.
Thank you, Deputy Taoiseach. To conclude.
Deputy, I believe in universal healthcare in Ireland, and as I outlined to you, it's something I've tried to make a reality in the last couple of years, and we continue to work on that. But there's a misunderstanding sometimes about how different health service models work in the world. People have private health insurance in the United Kingdom. About 10% of people do. In lots of European countries, almost everyone has health insurance. That's the case in Germany, that's the case in the Netherlands. It's also the case in France. So there are different models that work in different countries. Unless you're going to outlaw private health insurance entirely, and I think that might be your party's policy, perhaps not, you will always have people who have private health insurance.
I didn't say that.
But that is the case. You know, it is not the case that nobody has private health insurance in the United Kingdom. They do. And in fact, in a lot of European countries, they have an insurance-based model, and people are either required to have health insurance or they have a system of social health insurance run to their system. The NHS is not the typical model, by the way, across the European Union. They tend to use insurance-based models across the EU. In Australia, where they have a very good health service, it's a mixed system like ours. But there's one thing you did say, which is not correct. You said that people have better outcomes in the NHS. That is not correct. You're more likely to survive cancer in Ireland than you are in Britain. You're more likely to survive a stroke in Ireland than you are in Britain. You're more likely to recover from a heart attack in Ireland than you are in Britain. So the idea the NHS has better outcomes in Ireland, that's not correct. We've access problems, but we've better outcomes than the NHS.